Hello, everyone, and welcome to our third wellness webinar this year. My name's Adam Wilton. I'm the health promoter with Community Care Peterborough. Today, we're going to be talking about brain health in you. So that means everything relating to brain health, whether it be physical brain health, mental health, what we need to feed our brains, what we need to do to take care of our brains. But without further ado, we'll jump right into it. There we go. So what do we mean when we say brain health? Well, according to the World Health Organization, brain health is the state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. So what this means, without so many big words thrown in there, is brain health is a healthy state of functioning where we're able to emotionally regulate, we're able to deal with situations in a proper manner. We're able to properly process incoming information, whether that be vision, sound, things along those lines. And also that our body is working the way we want it to. So if we tell our right hand to shake, we're going to wave our hand and it does what we want it to when we want it to. And this happens throughout the full life course of people. So whether we're young, whether we're old, at any age, and this is happening whether or not we are facing mental health difficulties, things like stress, anxiety, depression, or whether it be uh, dementia, Alzheimer's, or Parkinson's, things along those lines as well. So really this kind of breaks down into two categories. We have our mental health and our physical brain health, which we're going to talk about in the coming slides. All right, so first we're going to talk about mental health. So the big three for mental health are anxiety, stress, and depression. These are the most commonly seen mental health disorders within Canada. There are also a variety of mental illnesses and disorders that can also occur, but these are typically a little more serious. Of course, anxiety, stress, and depression can become very serious. So if you think you're facing a very serious issue, you should always talk to a medical professional. But a lot of these other disorders you do need to be diagnosed for. So if you suspect something's wrong, it never hurts to go get checked out and to talk to somebody. But there is always things we can do to support our mental health. So first and foremost, I put get some vitamin D. Vitamin D is great for the brain. We get it from the sun, and it helps our brain produce dopamine, which helps us feel sort of excited, feel happy, get those good emotions going. But it's difficult to get vitamin D during the winter in Canada since we don't get very much sun. So there's a couple options we have. Um, First of all, you can always get a UV light for your desk. These are really bright lights that give you vitamin D from the special kind of light that they produce. They're an excellent option. Or if you prefer, you can take a vitamin D supplement, but it's definitely suggested that you speak to a physician first before you decide to take these vitamin D supplements. Next, what you're going to want to do is stretch your social muscles. So what we mean by this is you want to go out, have some social activity, go meet new people. This kind of provides a unique challenge and workout for the brain because you're going out and you're taking in other people's emotions. Like we mentioned on the last slide, you're getting information put into your brain and you're outputting other information. And it's also good to always, speak about how you're feeling, get things off your chest, whether something's been kind of weighing you down or not. It's always good to speak to someone. And yeah, going out and meeting people, talking to people is an excellent way to kind of provide a unique challenge to our brain. Even if you consider yourself introverted, it's always good to get even a little bit of social interaction. Next, we're going to talk about making sure your muscles are where your brain is rested, well fed, and hydrated. The brain is just like any other muscle in the body. We have to make sure it gets the nutrients it needs. We have to make sure it rests after getting a workout, and we have to make sure that it stays hydrated. So staying on top of our health and making sure that we're eating healthy, sleeping well, and drinking lots of water are excellent ways to keep the brain healthy and active. Staying physically active, also very important for the brain. As we mentioned on the last slide, those neural pathways are very important for when we are physically active. So we want to go out and kind of work out to make sure that every bit of our brain is getting worked. Also, exercise has been linked to lessening chances of developing things like Alzheimer's and dementia as well. So staying physically active is one of the best things we can do for our brain. Creating new routines is also a great way to take care of our brain and our mental health because it kind of gives our brain a bit of a workout. Learning a new routine or learning a new skill adds a new challenge for the brain, which again gives it that little bit of a workout that we kind of need to get those neural pathways firing, get everything working the way we want it to. And finally, if you feel that you are really need a little extra support, you can always talk to a medical professional and they can support you in whatever way they see fit, but it never hurts to get that little extra bit of support. We also are very fortunate in Canada to have lots of free supports available to us. The three you can see on the right here, Wellness Together Canada, Connects Ontario, and Bounce Back, are all available for free online. And some of these are provide you with resources in your local area that can provide you with the support you need, and others provide you with skill building sort of courses and classes you can sign up for. Some might be as short as like 5 minutes, some might be upwards to like an hour, depending on which one you kind of are interested in and the length of which you're willing to participate in. Um, but these but yeah, so that you can sign up for these courses very easily. They're completely free and they'll teach you the skills necessary to deal with, day-to-day stressors. If you're feeling high amounts of anxiety, stress, and depression, kind of give you some tools to help deal with these problems. All right, so there's also other illnesses that can affect the brain. Illnesses like dementia, Alzheimer's, Parkinson's disease, and stroke are very commonly developed with aging, but they can be slowed or prevented a little bit with proper care. The best way, as I mentioned, to kind of prevent these, the blanket fix that has been given across all of these is staying physically active. That's the number one best thing you can do. Some people do have genetic predisposition towards these diseases. Unfortunately, there's not much people can do about genetic predisposition. However, yeah, staying physically active, that's a great option. And we're going to talk on the next slide about a couple other things we can do to kind of take care and avoid these developing these diseases and illnesses. Um, so ways that we can avoid them, as I mentioned, physical activity improves memory, reduces anxiety and depression, can also reduce your risk of cognitive decline. So staying physically active, whether that means going out and doing an exercise class, is very important, but also doing things that kind of challenge your brain, like a puzzle or a Sudoku, I'm a big fan of. You can also do like crosswords, things like these that you kind of have to work the brain a little bit, work the memory. These are really important for avoiding developing dementia, Alzheimer's, and the other diseases mentioned. We can also take part in classes like at Community Care. We have our line dancing classes in a couple of our communities. So with these line dancing classes, you learn a couple movement patterns, you put them all together towards the end. So you have to memorize the patterns, memorize the moves, what order they come in. So this kind of memory recall is an excellent way to keep the brain healthy and working. So next we've got maintaining a healthy weight and lifestyle. So this helps with your sleeping patterns, helps with your food intake because you're going to be a little hungry if you're staying physically active. Um, and yeah, just eating healthy helps maintain a healthy weight and lifestyle. So it's all kind of interconnected. And then I highlighted avoiding smoking here. because smoking provides an absence of oxygen to the brain, and the brain primarily needs oxygen to function. So avoiding smoking is one of the best things we can do to keep our brain healthy. And smoking is attributed often to stroke and cardiovascular disease. So it kind of is a bit of a two for one there. So what is our brain hungry for? So first we've got fatty fish mentioned here. Fatty fish contain omega-3 fatty acids, along with eggs also contain these omega-3 fatty acids. These act as an anti-inflammatory for the brain, so it just really nourishes the brain, makes sure that everything is running properly. Next we've got broccoli and some other dark kind of leafy greens. These all contain folate, which fights brain atrophy. So for those of you that don't know, atrophy is when something kind of slows down and hardens. Often we'll see it in muscles as we age. Our muscles will not work as well. They'll get a little stiffer. So it kind of prevents that brain atrophy, and it keeps the brain healthy. Next, we got beans that are high in fiber. The same can be said for pumpkin seeds. These help kind of build the muscle and brain tissue and keep those pathways up and running properly that we've mentioned a few times. We've also got berries on here. I just wrote down blueberries, but there's also, 1,000 other kinds of berries that you can have. These are all important because they contain so many vitamins, so many minerals, and a lot of them contain antioxidants, which we'll talk about in a minute here. Um, but these all help, again, just nourish the brain, help stop the brain from atrophying, stop the brain from decaying, and just keep everything up and running properly. And finally, we've got dark chocolate on here, which also contains antioxidants, which is mainly used for preserving tissue. Um, so specifically brain tissue, I should say. So up on the right here, I've got some things that we want to look out in foods that we want to keep in mind, especially if we're thinking about brain health when we're cooking. So we've got antioxidants, like I mentioned, these preserve tissues, specifically in the brain as well. We've got our omega-3 fatty acids, which have anti-inflammatory properties for the brain. There's unsaturated fatty acids, so this would be found in stuff like olive oil. This is important because it lessens our chance of having a stroke. A stroke is when we eat lots of fatty food, lots of sugary food, it'll cause a plaque buildup inside our arteries and veins, and then eventually a piece of this plaque will break off. And if it causes a stroke, that means that some of the blood going to the brain receives a blockage in the artery because a piece of plaque has broken off. So eating these unsaturated fatty acids, it's easier for the body to digest, and it's less likely to cause plaque and thickening of the artery walls. There is choline, which is found in eggs. Again, this is pretty similar to the antioxidants, where it kind of helps keep those neural pathways healthy and running. And then last here, I have caffeine, and you can see I put in brackets there, maybe. I put maybe because caffeine is sort of individually dependent. Some people, might love having coffee, might need a cup or two a day just to feel like they're functioning. That's great because caffeine is a bit of a stimulant. It gets the brain up and running. But for other folks, such as myself, I know that I can't drink coffee because it makes me a little jittery, makes me a little anxious. So I try to avoid it. So knowing how much caffeine you're intaking and how much caffeine your body can kind of handle is important. So if you think you should avoid it, then definitely avoid it. Next, we're going to talk about all the things that community care can do for you. Some of these are related to brain health and others aren't so related, but I just wanted to highlight them because it's all important stuff to know what resources you have available to you. So first of all, Meals on Wheels. These provide affordable, nutritious meals that are delivered right to your door. So a lot of these meals contain the foods that we just talked about. So they're great for brain health. There's also grocery deliveries. So if there are foods that you particularly like that are great for your brain health, you can place an order, and eventually those groceries will get dropped off at your doorstep, and you know what you've got coming, you know what you can make, and you can kind of meal plan accordingly. Next, we've got our Diners Club. These are social gatherings that come at a reasonable price. So as we mentioned before, getting out, stretching those social muscles, absolutely great thing you can do for the brain, going and meeting new people. It provides a unique challenge for the brain that gives it kind of a special workout of its own. These includes things like healthy, you have a healthy meal. It kind of happens around seasonal gatherings often, or sometimes they're just special events for no particular reason. But you have a healthy meal, there's some form of entertainment, or if not entertainment, there's normally a health and wellness program where you can go and take part in an activity or class, or you learn some kind of new skill. And as mentioned, learning new skills again provides an excellent, unique challenge for the brain, gives it that unique kind of brain workout that we're looking for. Um, Next, there is transportation. This one, not so much to do with brain health, depending on where you're going, of course, but it provides safe, reliable transportation to and from medical appointments, treatments, shopping, community centers, social and recreational activities. So depending on where you're going, you can support your brain health at all times. And then finally, we have some other services. We have our home help program, where volunteers will come in and help you with some tasks around the house that maybe just are getting a little too challenging these days. We've got our friendly visiting program, which is either in person or online. So this is someone who can either call in or come visit you. It can be as short as 5 minutes just to check in, say hello, see how you're doing, and then they can go on their way, or you can have a nice lengthy visit. But again, stretching out those social muscles, getting the brain working. And finally, one that's near and dear to my heart, my personal favorite is our exercise and falls prevention program. Because as I've mentioned, exercise is the number one best thing we can do to prevent and slow the development of dementia, Alzheimer's, Parkinson's, anything along those lines. Well, that is it for today. If there's any questions, comments, or concerns, please feel free to email us. You can find the appropriate emails or phone numbers on our websites. Otherwise, take care, everyone, and enjoy the rest of your day.